Colon cancer. 7 symptoms that require urgent investigation. Welcome. Colon cancer is one of the most common yet preventable cancers, and recognizing the early signs can save your life. In today's video, we are uncovering 7 critical symptoms that should never be ignored. These signs could mean the difference between early treatment and a life-threatening diagnosis. Stay with us, because this information could be a game changer for you or someone you love. Symptom 1. Changes in bowel habits. One of the most common and early signs of colon cancer is a change in your bowel habits. This can manifest in several ways. 1. Persistent diarrhea or constipation. If you notice that you're experiencing ongoing diarrhea or constipation that lasts for more than a few days, it's time to pay attention. While occasional changes in bowel movements are normal and can be caused by diet or stress, persistent changes that last for weeks could be a sign of something more serious. 2. Narrowing of stools. If you notice that your stools have become noticeably thinner, almost pencil-like, this could indicate a tumor in the colon that's constricting the passage of stool. 3. Feeling of incomplete evacuation. You might feel like you can't completely empty your bowels, even after a bowel movement. This sensation, often described as tenesmus, can be a sign of a tumor obstructing the lower part of the colon or rectum. 4. Increased frequency of bowel movements. If you find yourself needing to go to the bathroom more often than usual, without any apparent reason like changes in diet or medication, this could be cause for concern. It's important to note that these changes should be persistent and unexplained. If you notice any of these symptoms lasting for more than a couple of weeks, it's crucial to consult with your healthcare provider. Symptom 2. Blood in the stool or rectal bleeding. One of the most alarming symptoms of colon cancer is the presence of blood in the stool or rectal bleeding. This symptom can manifest in different ways. 1. Bright red blood on toilet paper. After a bowel movement, you might notice bright red blood on the toilet paper when you wipe. 2. Blood mixed with stool. Your stool might appear darker than usual or have visible streaks of red blood mixed in. 3. Dark, tarry stools. Sometimes blood from higher up in the digestive tract can make stools appear very dark or black and tarry. It's crucial to understand that while blood in the stool can be a symptom of colon cancer, it can also be caused by other conditions such as hemorrhoids, anal fissures, or inflammatory bowel diseases. However, any instance of blood in the stool should be taken seriously and warrants immediate medical attention. Don't fall into the trap of assuming it's just hemorrhoids. Even if you have a history of hemorrhoids, new instances of bleeding should always be evaluated by a healthcare professional. The color of the blood can sometimes provide clues about the location of the bleeding, but only a thorough medical examination can determine the cause. Remember, early-stage colon cancer might not always cause visible bleeding. This is why regular screenings, including colonoscopies, are so important, especially for individuals over 50 or those with increased risk factors. Symptom 3. Abdominal pain or discomfort. Persistent abdominal pain or discomfort can be another indicator of colon cancer. This symptom can manifest in several ways. 1. Cramps. You might experience cramping pain in your lower abdomen. These cramps can be mild to severe and may come and go. 2. Gas and bloating. While occasional gas and bloating are normal, persistent and painful bloating that doesn't seem to have a clear cause, like dietary changes, could be a concern. 3. Feeling full or uncomfortable. You might feel full or uncomfortable even after eating small amounts of food. 4. Localized pain. Some people experience pain in a specific area of the abdomen, which could indicate the location of a tumor. It's important to note that abdominal pain is a common symptom that can be associated with many different conditions, from simple indigestion to more serious issues like inflammatory bowel disease or even other types of cancer. However, when abdominal pain is persistent, severe, or accompanied by other symptoms we're discussing today, it warrants medical attention. The nature of the pain can vary from person to person and may depend on the location and size of the tumor. Some people describe a dull ache, while others might experience sharp pains. The pain might be constant or intermittent. If you're experiencing unexplained abdominal pain that lasts for more than a few days, especially if it's accompanied by other symptoms we're discussing, it's crucial to consult with your healthcare provider. They can perform the necessary examinations and tests to determine the cause of your discomfort. Symptom 4. 4. Unexplained weight loss. Unexplained weight loss is a symptom that should always be taken seriously, as it can be indicative of various health issues, including colon cancer. When we talk about unexplained weight loss, we're referring to losing a significant amount of weight without making changes to your diet or exercise routine. In the context of colon cancer, 1. Rapid weight loss. You might notice that you're losing weight quickly without trying. A loss of 10 pounds or more in a short period, like a month or two, without any apparent reason, is cause for concern. 2. Loss of appetite. Along with weight loss, you might experience a decreased appetite or feel full quickly when eating. 3. Inability to gain weight. Even if you're trying to maintain or gain weight, you might find it difficult to do so. The reasons for weight loss in colon cancer can be multifaceted. The cancer itself can increase your metabolism, causing you to burn calories at a higher rate. Tumors can release substances that affect how your body uses calories and protein, leading to weight loss. If the tumor is large, it might obstruct the colon, making it difficult for your body to absorb nutrients properly. The discomfort or pain associated with the cancer might make you less inclined to eat. It's important to note that weight loss is often a late symptom of colon cancer. This means that by the time unexplained weight loss occurs, the cancer might be at an advanced stage. This underscores the importance of paying attention to earlier symptoms and getting regular screenings. Remember, while unexplained weight loss can be a symptom of colon cancer, it can also be caused by various other health conditions, including other types of cancer, thyroid problems, or digestive disorders. Any unexplained weight loss of 5% or more of your body weight over 6 to 12 months should be evaluated by a healthcare professional. Symptom 5. Fatigue and weakness. Persistent fatigue and weakness are symptoms that are often overlooked but can be significant indicators of colon cancer, especially when combined with other symptoms we've discussed. Let's delve into what this might look like. 1. Unexplained tiredness. You might feel extremely tired even after getting adequate sleep. This isn't the kind of tiredness that goes away after rest. It's a persistent fatigue that affects your daily life. 2. Weakness. Along with fatigue, you might experience a general sense of weakness or lack of energy. Simple tasks might feel more challenging than usual. 3. Shortness of breath. In some cases, the fatigue might be accompanied by shortness of breath, especially during physical activities that you previously handled with ease. 4. Pale skin. If the cancer is causing blood loss, you might notice that your skin looks paler than usual. The fatigue associated with colon cancer can be attributed to several factors. Anemia. Colon cancer can lead to chronic blood loss in the stool, even if it's not visible. This blood loss can result in anemia, low red blood cell count, which causes fatigue and weakness. The body's response to the cancer. Fighting cancer puts a significant strain on your body, which can lead to fatigue. Altered metabolism. Cancer can change how your body uses energy, leading to fatigue. Emotional stress. The stress of dealing with unexplained symptoms can also contribute to feelings of fatigue. It's crucial to understand that fatigue is a non-specific symptom that can be caused by many conditions, ranging from simple lifestyle factors to serious diseases. However, when fatigue is persistent, unexplained, and accompanied by other symptoms we're discussing, it's important to seek medical attention. If you're experiencing ongoing fatigue that's affecting your daily life, don't hesitate to discuss this with your healthcare provider. They can perform tests to check for anemia and other potential causes of your fatigue. Remember, listening to your body is key. If you feel that something isn't right, it's always better to get checked out. Early detection of colon cancer significantly improves treatment outcomes. So don't ignore persistent fatigue, especially if it's accompanied by other symptoms. Symptom 6. Nausea and vomiting. Nausea and vomiting are symptoms that can occur in more advanced stages of colon cancer, particularly if the tumor has grown large enough to cause a bowel obstruction. While these symptoms can be caused by many other conditions, in the context of colon cancer, they should be taken seriously, especially when combined with other symptoms we've discussed. Let's explore this in more detail. 1. Persistent nausea. You might experience ongoing feelings of queasiness or the urge to vomit. This nausea might come and go, or it could be constant. 2. Vomiting. In some cases, particularly if there's a bowel obstruction, you might actually vomit. This could happen occasionally or more frequently. 3. Inability to keep food down. You might find that you're unable to keep food or liquids down, leading to further complications like dehydration and malnutrition. 4. Abdominal distension. Along with nausea and vomiting, you might notice that your abdomen feels bloated or looks swollen. The reasons for nausea and vomiting in colon cancer can include bowel obstruction. If a tumor grows large enough, it can partially or completely block the colon. This obstruction can cause food and waste to back up, leading to nausea and vomiting. Changes in digestion. Cancer can affect how your body processes food, potentially leading to feelings of nausea. Side effect of the cancer itself. Sometimes the cancer can produce substances that cause nausea, reaction to pain, or discomfort. The discomfort associated with colon cancer can sometimes trigger nausea. It's important to note that nausea and vomiting are more likely to occur in later stages of colon cancer. This underscores the importance of paying attention to earlier symptoms and getting regular screenings. However, if you do experience persistent nausea and vomiting, especially if it's accompanied by other symptoms we've discussed, it's crucial to seek medical attention promptly. Your healthcare provider can perform tests to determine the cause of your symptoms. These might include imaging tests like CT scans to check for bowel obstructions, as well as blood tests and other diagnostic procedures. Remember, while nausea and vomiting can be symptoms of colon cancer, they're more commonly caused by other conditions like food poisoning, viral infections, or other gastrointestinal issues. However, when these symptoms persist or are accompanied by other warning signs, it's always best to get them checked out. Early detection and treatment of colon cancer can significantly improve outcomes, so don't hesitate to seek medical advice if you're concerned. Symptom 7. Unexplained anemia. The final symptom we'll discuss is unexplained anemia, which can be a significant indicator of colon cancer, especially in men and postmenopausal women. Anemia occurs when you don't have enough healthy red blood cells to carry adequate oxygen to your body's tissues. In the context of colon cancer, anemia often results from chronic, sometimes invisible, blood loss in the stool. Let's explore this symptom in more detail. 1. Fatigue and weakness. As mentioned earlier, fatigue is a common symptom of anemia. You might feel unusually tired and weak, even after getting enough sleep. 2. Pale skin. Your skin might look paler than usual, especially noticeable in the face, nails, and inside of the lower eyelids. 3. Shortness of breath. You might find yourself getting out of breath more easily, even during mild exertion. 4. Chest pain or palpitations. In some cases, anemia can cause your heart to work harder, leading to chest pain or a feeling that your heart is racing or pounding. Palpitations. 5. Dizziness or lightheadedness. You might experience episodes of feeling dizzy or lightheaded, especially when standing up quickly. 6. Cold hands and feet. Poor circulation due to anemia can cause your extremities to feel cold. The link between anemia and colon cancer is significant. Chronic blood loss. Colon cancer can cause slow, chronic blood loss in the stool. This blood loss might not be visible to the naked eye, but can lead to anemia over time. Iron deficiency anemia. The type of anemia often associated with colon cancer is iron deficiency anemia. This occurs because the body is losing more iron through blood loss than it can replace through diet. Unexplained anemia. In men and postmenopausal women, unexplained iron deficiency anemia is a red flag that often prompts doctors to check for colon cancer, among other potential causes. It's important to note that while anemia can be a symptom of colon cancer, it can also be caused by many other conditions, including other types of cancer, ulcers, heavy menstrual periods in premenopausal women, and certain dietary deficiencies. However, when anemia occurs without an apparent cause, especially in men and postmenopausal women, it should always be investigated thoroughly. Diagnosis of anemia is typically done through blood tests, including a complete blood count, CBC, and iron studies. If anemia is detected, your doctor will likely recommend further tests to determine the cause, which may include a colonoscopy to check for colon cancer. Remember, anemia itself is not a definitive diagnosis of colon cancer, but rather a symptom that warrants further investigation. Early detection of the underlying cause of anemia, whether it's colon cancer or another condition, is crucial for effective treatment. As we conclude our discussion on the 7 critical symptoms of colon cancer, it's important to emphasize a few key points. 1. Early detection is crucial. Colon cancer is highly treatable when caught early. Regular screenings, such as colonoscopies, are vital. especially for those over 50 or with increased risk factors. 2. Pay attention to your body. The symptoms we've discussed, changes in bowel habits, blood in the stool, abdominal pain, unexplained weight loss, fatigue, nausea and vomiting, and unexplained anemia should never be ignored, especially if they persist. 3. Don't panic, but don't delay. Experiencing one or more of these symptoms doesn't necessarily mean you have colon cancer. Many other conditions can cause similar symptoms. However, if you're concerned, don't delay in seeking medical advice. 4. Lifestyle matters. While we can't prevent all cases of colon cancer, maintaining a healthy lifestyle can reduce your risk. This includes eating a diet high in fruits, vegetables, and whole grains, staying physically active, maintaining a healthy weight, limiting alcohol consumption, and not smoking. 5. Spread awareness. Share this information with your friends and family. Awareness is a powerful tool in the fight against colon cancer. Remember, your health is in your hands. By staying informed, paying attention to your body, and seeking medical advice when needed, you're taking crucial steps in protecting yourself against colon cancer and other health issues. Thank you for joining us for this important discussion. Stay healthy, stay informed, and don't hesitate to talk to your healthcare provider if you have any concerns about your health. See you next time.